the good thing about these acute traumas and overuse injuries, if that's the cause of your low back pain or your neck pain or your mid back pain, you've got to think, okay, this pain, I woke up with it, or I remember trying to lift that sofa and I felt a pop, and ever since I couldn't move. If there's something like that, or I started a job where now I'm laying tiles on people's basements, so I have to be on my knees laying tiles for 8 hours a day. I've never done that in my life, and ever since my back's kind of sore. You've got to rule that out. That's a mechanism. If there's such a thing, regular, everyday, average therapy is going to help. Meaning, you go see your chiropractor, you go to your massage therapist, you go to your physio, you go to acupuncture. I mean, body work generally is going to help soothe the tension in the muscles. It's going to give you relief. And the other thing I tend to tell people is that when it's a physical trauma or physical injury, there's this bell curve to the way the pain presents. You start with the injury, and then it really hurts within a day or two after the injury, and then it starts to feel better within a day or two after that. So within a week or so, you should notice, I hurt my back because I slipped on the ice last week, but you know what? It's been 5 days. It's already feeling a little bit better. Okay? So again, that generally tells us that there's a mechanism of injury. It's a physical trauma, either acute or overuse, and getting therapy is going to help alleviate or improve that. Okay? So this is easy because this is what we normally think when we have pain, that I must have done something like this. Okay? But if it doesn't follow this bell curve, if your pain gets worse and it stays worse for the next 3 weeks, then it can't be this, okay, necessarily. Or if it gets worse, it gets better, it gets worse, it gets better, it gets worse. Then again, there's something else potentially going on. This is where we implement G&M, the 5 biological laws, because if there isn't a physical trauma that caused your pain, we're looking for some sort of emotional conflict shock, something unexpected that you dealt with in your life that you affected the part of your brain that controls the muscles or the ligaments of your back.